Happy Hospital Week. I am Maureen Kahn, President and Chief Executive Officer of Blessing Health System, and you are all healthcare heroes. Each year in this message, I talk about teamwork. In this pandemic environment, teamwork takes on a new meaning. I would venture to say that the teamwork you have demonstrated over the past 60-plus days has been a historic chapter in the Blessing story. Historic because of what you have done for the residents of the communities Blessing serves, and historic because of what you have done for yourself, your loved ones, and your coworkers. Nearly 220 healthcare providers around the country and the region laid off staff over the past 2 months as a result of financial losses from COVID-19. The St. Louis-based SSM system furloughed 2,000 employees for up to 13 weeks. Unity Point Health implemented an unspecified number of layoffs. Mayo Clinic furloughed or reduced hours of almost half its workforce, some 30,000 people. Blessing Health System has escaped that fate so far. How? 3 reasons. 1, incredible stewardship over the past 145 years that has led to a financially strong organization. Reason 2, a commitment by the Blessing boards of trustees to the well-being of the health system's employees and their dependents. And reason 3, a culture that leads Blessing employees to do whatever must be done to meet a need. During our COVID-19 response, many of our caregivers have spent their precious off time in locations away from their families, living in campers, for example, so that they could continue to work and meet the community's healthcare needs and protect their families through self-quarantine. During our COVID-19 response, when elective surgeries and invasive procedures were postponed, many of you trained for jobs you had never done before, including symptom screeners at entrances and EVS and food and nutrition helpers. That allowed you to continue working and to help the health system meet the community's COVID-19 needs. During our COVID-19 response, our financial and revenue cycle teams worked to learn about and understand and apply for federal and state programs that supplement the millions of dollars that the health system was losing because of elective surgeries and invasive procedures that could not be done. Those dollars have allowed staff to keep working, to keep earning paychecks, and to keep meeting community needs. This amazing teamwork on every level of Blessing Health System resulted in full employment during the COVID-19 response. Not every healthcare provider can say that. We are blessed, and we hope to be able to continue at full employment. Many factors outside of our control will dictate what we can do going forward, but the commitment to you remains strong. We have not and will not take our focus off the COVID-19 situation in our region. It remains a threat. However, we feel we can do that and safely bring our healthcare services back to our patients, including elective surgeries and invasive procedures. The rescheduling process is underway, and patients have begun receiving their postponed care. Your teamwork will be needed for this endeavor too, as there are thousands of patients who have had care postponed by COVID-19. In closing, I ask you to do me a favor. Please thank your loved ones on behalf of myself and the members of the Health System Board of Trustees for the sacrifices they have made during the COVID-19 response and the sacrifices you and they may need to make in the weeks and months to come as we return to full operations. Thank you for being healthcare heroes. Do you know what your superpower is? I do. It is the true human connection you make every day. Happy Hospital Week.